Hey, good afternoon, everybody. This is Jeremy Warren from Greenville, South Carolina. Look forward to talking to you today about some of the strategies to optimize data entry into the QC, some of the ways that we've had some success and where we still struggle in some areas. I think most importantly, and I think you're going to hear this echoed throughout the talks today, you have to recognize the value added to your practice that the QC provides. Just the ability to have real data, granular data on hernia repair and your outcomes provides you the ability to do true quality improvement within your own practice. It allows you to better consent your patients when you can quote them your SSI information, your recurrence data, your length of stay for a given operation. You can know that it's reliable. This is also a great way to log your cases and helps with maintenance of certification. It's a great tool for research for those who are interested in it, and certainly provided a lot of high level data, very granular data on hernia repair using some big numbers that are just simply difficult or impossible to get from traditional trials. And I think you'll hear later today as well how this can be a useful tool for you in marketing or maybe even contract negotiation. So again, you have to appreciate the value added to your practice, to you, to your patients, or you're just simply not going to use the QC effectively. So how we do it at Prisma, I just want to walk through with you each of the basic phases of care. So from the new patient visit to the follow-up, and how we use the QC at each of these levels. So first, before the patient ever gets to us, they're actually sent a letter with their new patient package to address the QC, inform them what it is, how we use it, what data is collected, how that data is handled. So they have some background information coming into us from the get-go. And then during the initial visit, talk about the QC. This is not always an explicit conversation, but as I mentioned before, this is incredibly useful for informed consent. So as we're talking to the patient about the risks and benefits of a given procedure or the options of how a hernia could be fixed, we're able to reference our own QC data to have the best conversation we can with that patient, inform them to the best of our ability what their outcome is going to be. And at the same time, assuming that we decide to go ahead with surgery, we have them complete their baseline PRO just in paper form. And I'll talk about in a minute about how we actually enter that. Utilizing your EMR, I think, is key. So when you're completing your in-office documentation, having some standardized language in your note templates, I think, is incredibly helpful. For example, I have a brief sentence at the end of my HPI that indicates if the patient takes any opioids chronically or has any psych history. You could do the same thing for functional status, for hemoglobin A1C and diabetic patients. So, use your EMR and use your H&P templates to accurately capture the data that you know is in the QC. And that'll save you some time on the back end when you go to enter that information. So the actual data entry begins with our scheduler. What we identified in our practice is that the scheduler is really getting a ton of the data that's already in the demographic tab anyway. So she's getting their name, their contact information, their email, their insurance information. So we just had her start to add that demographic tab data into the QC as she's doing the scheduling. And we actually just have her enter that baseline PRO as well, which only takes a few extra 30 seconds to add that once she's already in the QC anyway. So that's been an incredibly useful way for us to get that initial data entry into the QC. When we get to the point of surgery, this is really where we have to do all the work. The operative details are entered by the surgeon. We typically do the pre-op evaluation as well. The templates used for our H&Ps are incredibly helpful for this. Templated language in the operative notes can be incredibly helpful for this as well. And I think what's most important to entering accurately and efficiently the QC data is to enter it promptly after the case. Ideally, do this while you're doing your other post-operative documentation. You'll remember the time, you'll remember the blood loss, you'll remember the little things that you did in the surgery. Entering this, days or weeks later is just not as accurate and certainly not as efficient. The other thing that's helpful, a new feature, is the save as draft function on the 30-day follow-up. I think this is going to really impact our ability to better capture some of the complications that occur, particularly in hospitalized patients, and particularly if they've been in the hospital for longer than expected. Um, the 30-day follow-up entry is really reliant on the discharge documentation. So if a patient has an ileus or maybe a UTI or something like that that's not explicitly stated in the discharge summary, I think we were probably missing most of those. So having this save as draft function really lets you input some of those complications real time. And for me, at least, it's been really helpful in going ahead and putting in the discharge prescribing information for our opioid module. And I can put that in as I'm doing the discharge or as I'm sending those patients home from an outpatient procedure. I think that's an incredibly useful thing for our nurse practitioner on the back end. Our post-op patients are seen almost exclusively by our nurse practitioner. So she's going to enter those 30-day outcomes. Again, the save as draft entries are really helpful for her to make sure we have accurate information, and it helps her just from an efficiency standpoint of having some of that information already entered. And then the 30-day PRO is administered at that 30-day follow-up visit as well. That is currently entered by our research coordinator in the office. We've gone back and forth a few different ways of doing that, and this has seemed to be the most effective and efficient for us. So again, just to kind of sum up and add some times into this, our surgery scheduler is doing the initial data entry in the demographics tab as well as the baseline PRO entry. The surgeon is entering the pre-op, the common operative, and the operative details. Nurse practitioner is entering the bulk of the 30-day follow-up, aided by any surgeon-entered data under the save as draft function. All in all, this tends to take somewhere between 8 and 10 minutes, depending on the complexity of the patient. But on average, we're less than 12 minutes across the board. And we've actually done some analysis of this and had each person time their average entry. And this is about what we've come up with. Some of the areas that I think we still struggle, I mentioned this already, in the 30-day complications, I think we were probably missing a fair amount of in-hospital complications if they were not explicitly documented in the discharge summary. So I think the save as draft function and being able to enter some of those things in real time is a real benefit of this new function. I think long-term follow-up is still something that we struggle with, and I know we're not alone in that. Even the patients that come in to the office for long-term visits, sometimes we just don't get the right time frame and don't get them the PRO questionnaire. So I think we still really struggle with this, and I'm actually looking forward to hearing how other people do this today and hopefully bring some of that back to Greenville and help us to improve the data entry on our long-term patients. So again, just to summarize here, find a system that works for your practice. This is how we do it, and it works well for us. Not perfectly, but it works well. I know that I've talked with some of you before and have a very different system, and that's okay too. Find what works best in your practice. Enlist your staff to help you out with this. Make sure you're using your technology optimally. So template your HMPs, template your op notes to make those help you in entering the QC data. Enter the data as promptly as possible after the operation so that you don't have a lag, which is going to make you both less efficient in entering the data and potentially less accurate in entering the data. That save as draft function in particular can be very, very useful, especially for the 30-day follow-up. And then just engage your patients. When you can engage the patient up front and particularly engage them on the back end, maybe when you're done with your initial post-operative care, I'll often have this conversation of, hey, we want to know how you're doing in a year from now, 2 years from now, 3 years from now. So this is an incredibly useful way for you guys to give us feedback on how you're doing in the long run, and helps us to take better care of hernia patients in the future. And I think patients really respond well to that, and I do think that's helped us get some additional long-term follow-up. And then look forward to feedback from the group here, from the QC participants, on how they do this and how we can potentially improve the process. Some of the ways that I think we're already looking at improving this process is doing some quarterly reporting, which will include some of the data entry components. So how often are you capturing 30-day outcomes, 30-day PROs? How many long-term follow-ups are you getting? What's your overall volume, and are you capturing it well? And I think doing some things to potentially streamline the data entry are being looked at. So maybe rearrange some of the data points to facilitate most efficient entry. In particular, moving the BMI from the common operative page to the preoperative page. That's one thing that you have to look back in your EMR for to get access to on the day of the operation that you otherwise could just enter directly from your memory as you're walking out of the OR. Maybe even doing some templated operative procedures, that will pre-select certain fields based on the type of operation that you've done. So just things we're looking at in the future. And again, look forward to the discussion today and learning from the rest of the group here how this has been done by your practice, and maybe take some of that back to us here in Greenville. Thank you very much.